So I'm often asked, doctor, what can I do after the surgery? And the answer to that is, even though the goal of the surgery is to make you a normal person and being able to do anything what a normal person can do, that may take time. Considering that open old-fashioned surgery completely destroys your muscle around your spine, our surgery, Oluf, the transcabin Oluf, does not disturb the muscle around the spine, so it enables the patient to retain most of the function and come back to normal life much faster, but it's still a surgery. In this kind of surgery, usually patient has to recover from the initial surgery, and as well, before the surgery, patient already had lots of limitation, and it will take time to come back to what we consider normal. Now, obviously, normal is not the same for everybody, and I'm asked, I used to do this and that. If those things that you have been able to do just before the surgery has been like within a year or two before the surgery, usually patients should be able to return those activities within a few months after the surgery. But any excessive activity, like running marathon or doing excessive contact sport, these are activities that are probably going to take a little longer to achieve those goals. Now, having said that, I'm just going to tell you a few things that I think are unrealistic. Like I had a 72-year-old patient who wanted to do running marathon about 2-3 months after the surgery. That would be practically a little stretching the ability of your body to recover. And obviously, I had another patient that just 4 weeks after the surgery put a swing set, 1,700-pound swing set alone together for his grandchild. Well, I'm happy that he felt good enough that he's able to do that, but he loosened all the screws. I had to go back and revise the surgery. We don't want things like that happen. Those are unnecessary. So any excessive activity will cause some damage and actually delay the healing process. The best way to understand what you can do and what you cannot do, we can sum it up in BLT, which is bending, twisting, lifting. We don't want you to do that because that is where it put a lot of stress on those hardware that we put in. Our patient are in a good position that they can walk within hours after the surgery. Most of them go home within a day after the surgery, and practically they're back to the basic previous life within 2 to 4 weeks after the surgery. But I have to emphasize what basic previous life is. It's definitely not going on trampoline. It's definitely not driving 600 miles on a bike, and definitely not going for kayaking. I'm using this example because these are actual things that our patient have done, and they were upset that then they had pain afterward. Unfortunately, our body heals at a certain rate. That rate is individually different for every patient, and that is how you are going to heal. It's in the future. I don't know. I can't just give you statistic about how patient before you, after a surgery like that, have healed. And generally, as we discussed, 2 hours before they walk, that would be unimaginable after open old-fashioned surgery. About the day before they are able to go home. They're not pain-free all the time. Some of the patients are, but certain activity will be always painful for a while. And those activities are those that put too much stress on your spine. 4 weeks to return to basic previous life. And if you do a desk job, many of my patients within 2 to 4 weeks go back to their desk job. But if you are a truck driver, if you are a farmer, if you are a firefighter, if you are a police officer, you have to slow down certain activities. Like, again, another example of a semi-truck driver who put a whole semi-truck tire by himself on and was painful for a while. Or a police officer who is very anxious to get back to job and do tackling criminals. And yeah, I hope everybody is chuckling now, understanding that those are activities that are individually so different. There's no way anybody can tell you when you are ready for that. The healthy way to get into normal activities, starting at the level that we know for most of patients are all right, which include, no bending, twisting, lifting, lifting not more than 8 pounds for 2 weeks, not more than 15 pounds for a month, not more than 25 pounds for 2 months, and not more than 35 pounds for 6 months. And until we see sign of fusion, nobody should lift up more than 50 pounds. But then this is just a kind of a rule of thumb. But if you are going to increase the activity, the best way to do that is just add few more pounds, few more minutes to walking. Small frequent walks are perfect. And then watch yourself for a few days. Sometimes the pain will come back a few days later. The best way I have found out you can adjust it is to have a logbook. Write down your pain and write down your activities. And if you see a correlation between some activities and pain even a day or two later, then you know what your bodies are able to do. Like a patient of mine who had always, toward the end of the week, back pain was getting worse. We found out that Wednesday is her gardening day, and that sort of actually had bending, twisting, lifting. Most of people are able to identify what makes their pain worse. But if you make it systematically, a logbook, what you do, what your pain is, you can come back to essence of what help you heal and essence of what makes your pain worse much faster and better. Now again, there's no way I can tell you how you are going to heal. I can just recite you the statistic of people before you, but individually, every patient is able to find out their limit. Now, having said that, there are certain activities, like again, as an example, this is an actual example. A patient sent me a form that says I should certify her or him for those activities. Like on that list was like retrieving emergency equipment. I can't just shake my head about that question. Now, what are those emergency equipment? Where are you going to retrieve them from? How are you going to carry them? Is it a 2 pounds external defibrillator, or is it a 500-pound the jaw that you are going to cut pieces of a car? You see that there? That is a question that I could never answer. Or another thing was carrying a fire extinguisher. Now, is it a small one or is it a big one? Are you going to have to bend to carry them, pick them up? Do you have to, hold them in one hand or both hands? All these are beyond something that any surgeon can answer. But coming back to the core of what we are saying is that no bending, twisting, lifting, and lifting limitation, and you add to that, if it can fit in that environment, it's probably good. If you are going to do more of it, add to it every few days, few pounds, and do a little more, like frequent small walks are good. But I had a patient that 5 days after the surgery wanted to go for a 5 miles walk. Now, it's okay to go from 200 yards to 300 yards to 400 yards and slowly go up and increase the activity until your body tells you it's okay. But I hope that everybody's common sense agrees with that I'm going from nothing like you were before the surgery to 5 miles a week after the surgery. That put too much stress not only on your hardware and what the area we did the surgery, but on you as a person. So I cannot tell you for you specifically what your limitations are, but there's a way we can find it out as we discuss. Another thing that I'm asked, and I think it's important for everybody, is that when can I return to work? That is, again, very specifically different regarding you, what you got, as well the kind of surgery that you got, and as well what kind of work you do. It's more depending on the kind of work you do than anything else. I hope you understand that I can tell you that many of my patients with the desk job, they can go within a week or so back to work. But if you are a roofer, if you are a carpenter, that there are different requirements that your body needs to be ready for. Having said that, I have had many patients with who are farmers or heavy carpenters who do mechanical work that are able to go within weeks back to work, which would be unimaginable after open surgery. But individually for you, I cannot promise that. Nobody can. I just know, and I have the data to show you that you can go after our kind of surgery with minimal invasive surgery faster to work than any other kind of surgery. Now, the way sometimes this question about can I do this, can I do that at work is important. If that is a crucial part of the surgery, what you need to do is to let us know. There are certain professionals, we call them work environment safety specialists, that what they do, they come to your work after, before or after the surgery and see what your work is like, and they see how they can fit it to your work environment, telling you to do that or not to do that, but as well showing you some modification of the activities that you can do to enable you to do that. But again, I won't be able to come to your work, unfortunately, and I won't be able to perform this function for you. So if the question of if you can do your job or not is extremely important, and there are specific things like carrying emergency equipment is a crucial part of your work, you have to bring that specialist to you to watch you and give you some advice regarding that. Now, there's no way in individual case that me or anybody from my office can come to your work environment to do that, but we can help you to connect to proper people who can do that for you. Many of the improvement in life activity, even though fastest with our surgery, are going to take time. You have to be patient. That's why they call you patient. And if you are impatient, you are going to just delay that healing process. Additionally, in the healing process, you have to listen to the cues and the signals your body gives you, and not try to overcome that. Trying to take pain medication to do things that are otherwise painful is the worst way to go around that, because your pain is your body's signal to tell you it's too much. If you are practically neglecting the signals and silencing them with pain medication or any other mean, you're practically ensuring that you're going to have some damage from activities that are harmful to you. I think one of the last things I want to add to this video regarding your expectation is that aging is a natural process in life, and our surgery is able to enable you to regain your function in your age group as fast as possible. But again, from example, there's people telling me 2-3 years after surgery, everything is good, pain is gone, but I still cannot go do things I could do before the surgery, which was 5 or 10 years before. We can make you the best that you can be for your age group. Unfortunately, it is out of our hand to turn back the time and make you younger, in a sense that you performing how you were 20 years ago. Idea here is that finding you activities that are age appropriate for you, and like again from examples, driving 600 miles on a motorbike for an 80-year-old person is probably less appropriate activities, but we are able to make you age appropriate as fast as possible with the least amount of complication, but still we are going to not be able to make, if you're 80 years old, make you perform at a 50-year-old level. No surgery can. And by setting up your expectation as such, you're just going to be dissatisfied So let's talk about those things before the surgery. If you have questions, talk to us. Thank you.